Okay, hello everybody. Welcome to our webinar on COVID-19 and vaccine distribution information. My name is Carol and I'm coming to you from the Ashland branch of the Pamunkey Regional Library. Before I introduce our presenters, let me cover a couple of housekeeping items. Please, we ask that everyone remain muted throughout the presentation. If you have questions, please put them in the chat box. I will be compiling those questions and we'll ask them of our presenters at the end of the program. Also, we are recording this program. It will be available on the Pamunkey Regional Library website in a day or two. So if you don't want to be recorded, please turn your cameras off, and then just your tag will show and not your pretty face. I think that's it for the housekeeping. Thank you for joining us, and let me introduce our presenters. We have Caitlin Spencer, who is the COVID-19 health specialist, and Abigail Williams, a public health educator, both from the Chickahominy Health District of the Virginia Department of Health. And without any further ado, Caitlin and Abigail, you take it away.
Hi, everybody. I'm so glad so many people were able to join us today. I know this is a very important topic these days, and it's hard to find correct information out there and everything. So hopefully we can help clarify a few things for you guys today. We've created an awesome PowerPoint. We'll take questions at the end. And on our last slide of the PowerPoint, we have some really great links that you guys can follow and get more information as well. So we'll jump right into it. So goals of the vaccine, it's to ensure protection of the recipients and, oops, sorry, I'm trying to get my screen figured out here. There we go. To ensure protection of recipients for an extended time and to ensure a vaccinated person cannot pass COVID-19 onto a non-vaccinated person and to obtain long-lasting herd immunity. So the types of vaccines, currently there's 2 vaccines that have been authorized and recommended to prevent COVID-19. The first one we have here is the Pfizer vaccine. This is a mRNA vaccine, and it comes in a 2-shot series, 21 days apart, and it's given in the shots in the muscle of your upper arm right here. And it does not contain eggs, preservatives, or latex. The second one, Moderna, that is what our health department is currently offering as of now. And that is also an mRNA vaccine. Same thing, 2 shots, but 28 days apart. It's also given in the muscle of your upper arm. And this one also does not contain eggs, preservatives, or latex. So how the vaccines work. COVID-19 vaccines, they help our bodies develop immunity to the virus that causes COVID-19 without us having to get the illness. Different types of vaccines work in different ways to offer protection, but with all types of vaccines, the body is left with a supply of memory T lymphocytes as well as B lymphocytes that will remember how to fight the virus in the future. It typically takes a few weeks for the body to produce T lymphocytes and B lymphocytes after vaccination. Therefore, it is possible that a person could be infected with the virus that causes COVID-19 just before or just after vaccination and then get sick because the vaccine didn't have enough time to provide protection.
So mRNA vaccines, how do they work? The mRNA vaccine has instructions to make a protein, also known as the spike protein. And that protein allows the virus to get into our cells and replicate. So the mRNA vaccine has that spike protein, and that in turn, when it's injected, causes our immune system to launch a response. This is when people typically see symptoms arise because your body is fighting off this protein. If COVID enters the body after vaccination, the memory cells created to attack the protein will then launch an attack on COVID cells due to our immune system recognizing the protein. So mRNA vaccines cannot give you COVID because they do not contain a live virus. They do not affect your DNA. They only have the spike protein coding, and those instructions from the mRNA vaccine will then be destroyed after your body fights it off, and you're only left with the memory cells to then fight that protein. Sometimes after vaccination, the process of building immunity can cause symptoms such as fever, chills, and soreness around the injection site. These are normal, and they're just signs that your body is building immunity. Symptoms appear to be more common after the second dose of the vaccine, according to the clinical trials. The CDC has implemented vSafe. This is a smartphone app that allows you to text or survey your symptoms post-vaccine, and it also has telemedicine visit options, as well as it will remind you of your second dose.
So here is a great map. As of yesterday, we have this many people have been fully vaccinated in Virginia, and you can just kind of look at all these different numbers. Our goal is to get at least 50% of the population vaccinated. We're at 8.7. So we're slowly getting there. This is going to be a long process, but we're making, great strides to get to that goal. And this next map, this shows just the different facilities who've been offering the vaccine. So far, hospitals and our local health departments are in the lead with that. Hopefully in the near future, places like your medical practices and pharmacies will be able to offer these vaccines for the community a lot easier and faster. And so far, there's 35,880 doses administered each day. So that's a great number.
So who can get the vaccine? The ultimate goal, obviously, is to vaccinate everybody, or however many people are willing to get the vaccine. Virginia is currently vaccinating those in groups 1A and 1B. On the next slide, I do have a chart that lists who's included in those, but 1A is healthcare personnel and long-term care residents. 1B includes frontline essential workers, such as grocery store employees, those who are 65 and older, 16 through 64 with underlying conditions that increase your risk of serious illness, those who live in correctional facilities, homeless shelters, or labor and migrant camps. The demand is much greater than the supply we currently have. Our allotted supply is not expected to increase until March as of right now. Those who receive a first dose will receive their second dose 3 to 4 weeks after their first. So this just kind of goes into more detail of who's included in which phase. This is on the website, VDH website, so you can refer back to that in your spare time if you're curious. It also has a link to a survey to see which phase you're eligible for. So phase 1A and 1B together are about 50% of the state's population. Currently, the entire state is allotted 105,000 new doses a week. So that's split in between all of the districts, and they're looking at that number to remain the same until March, which would then hopefully by March or April, phase 1B demand will be met. So if you register today for the waiting list to get a vaccine appointment, it could take 3-4 weeks or even longer before you can get your appointment. This link below is for eligibility. It's the survey I was talking about a few minutes ago. If you're eligible through your employer, check with them to make sure they haven't set up a vaccination for you. If not, register with your local health department. If you're eligible by age or health condition, you do need to register through the local health department. During your appointment, you will be required to wear a mask. Following your vaccine, there is an observation period in place just for safety precautions. If you don't have a history of an immediate allergic reaction or anaphylaxis for vaccines or other injectable therapy, you only have to stay 15 minutes. If you do have those histories, they will require you to wait for 30 minutes to observe you. You will receive a vaccination card for your records. Most of the time, they will put a date on there for your next appointment. If not, they will be contacting you after your first appointment. You will receive a fact sheet, whether you receive Moderna or Pfizer. They'll give you all the information for those, as well as that information is online. So this is just more about why it's important to get both doses. So the first dose jumpstarts your cells and your body will start to make antibodies. The second dose is the exact same formula as the first. but it will give your body another chance to fight the virus and boost your antibodies. Typically, they are 3 to 4 weeks apart. However, there is a 6-week window that if for whatever reason you can't get an appointment, for Pfizer 21 days after and for Moderna 28 days after, you do have a total of 6 weeks that the CDC says you won't need to repeat your doses. So after your vaccine, we highly encourage you to download Be Safe. It will help you, track your side effects, give you tips to deal with the side effects, as well as you could do telemedicine visits. Make sure you get your second dose. It is very important to do that because it gives you optimal protection. After you've received both doses of your vaccine, it's still important that you follow the current guidelines. You need to wear a mask, maintain 6 feet, and regular hand washing. It can take up to 1 to 2 weeks after your second dose for you to get optimal protection, which is why it's important you to continue these protocols. Also, not everybody has been vaccinated due to our supply being limited. You could have been exposed, 5 days before your vaccine or a couple of days after, which would cause infection prior to your vaccine taking full effect. It's not yet known if your vaccine will stop you from spreading COVID to a non-vaccinated person. So if you contract it asymptomatically, we're not yet sure how contagious you would be. If you've already had COVID, we do still advise you get vaccinated. It is possible to become reinfected. Natural immunity varies from person to person, and we're not yet sure how long it'll protect you. Underlying conditions, we do still highly recommend you receive the vaccine unless you've had a severe allergic reaction to the vaccine or any ingredients in it. We're still researching how long you will receive protection from the vaccine. It could be very similar to the flu vaccine where you would get it each year. Hopefully it'll last longer, but we're not yet sure. It's still in the research phase. Currently, all of our research supports the vaccine is still effective against the new variants. The mutations in the variants do not appear to be the same sequence that we used for the vaccine. The COVID vaccine will not cause you to test positive on a PCR or an antigen test. So if you're traveling 2 days after you get your vaccine and you're required to get a test beforehand, it will not cause you to test positive. It is possible that if you take an antibody test, it will test positive because that's the point of the vaccine, is to give you antibodies to fight the virus. If you do plan to travel, having been vaccinated will not excuse you from any CDC travel restrictions or the testing protocol. So if you are required to take a test before traveling, just because you have your vaccination card does not mean you won't have to get tested. Make sure you keep your vaccination card. At some point in the future, this may be required for traveling. The CDC recommends 14 days between COVID vaccines and any other vaccination. The CDC is still addressing if the vaccine limits those who contract asymptomatic COVID. And natural immunity versus immunity from the vaccine. It's still controversial at this point what people think about this, but the point of the vaccine, if you are to contract COVID-19, it does limit the severity of your symptoms. COVID-19 has some very serious risks as well as long-term health issues that we are still finding out each day. So we do encourage you to get the vaccine if you're able, as soon as you're able to, because yes, after you get COVID, you will have a natural immunity for some time, but with the vaccine, it will lessen your risk of severe illness from COVID. Vaccines all have to go through clinical trials and be authorized or approved by the FDA. Pfizer's clinical trial had 20,000 participants and Moderna's had 15,400. Each vaccine has received an emergency use authorization through the FDA, and the FDA and CDC have put additional safety monitoring in place. Be Safe is one we've talked about, as well as existing measures that have been in place for years for all the other vaccines are listed here.
And finally, this is the last page. You guys might want to take a picture of this or, jot down these links. These are super helpful. This first link right here, probably the most important one that people are going to have questions about. This will send you to a form to fill out to get yourself signed up for the vaccine. And this, I will say, and make this very clear, this does not register you for your vaccine appointment. This is just getting your name onto a list. So when time comes for you to get your vaccine, you will be emailed to sign up for your vaccine appointment with a date and time and location that you would like to pick. The second link here is what Abigail was saying. You could go on here and find out what phase your county or city is in, and also find out which of those phases categories that you fall into yourself. You can use this to, for any of the family members you have that might have questions about, well, when can I get my vaccine? What phase do I fall in? Go to that website. You'll find out all those answers right there. And this third link right here, if you have, this is just kind of like a FAQ, any like commonly asked questions, they're answered on there, and some other information maybe we didn't touch on today. That's a great resource right there. And this last little bullet right here is our new COVID hotline call center that we have in Hanover County. You can call that number between 8:30 and 4:30, Monday through Friday. We have a team of people over there answering calls between those hours all day pretty much. They're a great resource. They can help you get your name put onto the list for the vaccine, answer any questions you have about the vaccine, and kind of help direct you where you need to go based on what questions you have. And then that's another number right there at the bottom after hours that you can call and get information as well. So that is the end of our presentation. We can open it up for questions now. I can leave it on this last page a little bit longer to give folks some time to write down those links or take a picture of them.
I will go ahead and say the hotline has been seeing a very large number of calls. So if you are able to register yourself online for that wait list for the vaccine, we highly encourage you to do so. We also encourage you to use these resources we've put here on this page, see if you can find the answers to your questions. If not, then give us a call. If you leave a message on the hotline, they will call you back. However, there is a lot of calls coming in, and people are constantly on the phone and the phones are still ringing. So they will get back with you. Please do not call multiple times and leave multiple messages. We will return your call. But they are just very busy over there and working their hardest.
Well, thank you, Caitlin and Abigail. We're getting some questions here, and I will start with first one. We'll get as many as we can answered. This person says, I think I'm registered, but I'm not sure. How do I confirm that I'm on the list?
So they did just put in place today, or earlier this week, so Monday, where there is now an option for when you register for you to get an email with your form and the answers you submitted. Before that, we did not have this in place. So there is a possibility, you called in registered or you filled out the form online and you did not receive that confirmation email. What we could do is we could just have you get re-registered. If you're on there twice, it's not a big deal. So if you're not positive you're registered, but you think you are, but you want to be safe, just go ahead and register again. It does not hurt to be on there twice.
Good, thank you. That was my second question. If you've registered several times, just trying to make sure you're on there, is that going to create a problem? And I think you've just answered that for us.
As of right now, we don't have a problem with that.
Good. Next questions. What happens when those who go to get their second shot and it's not the same vaccination brand? For example, if you get Moderna the first time around, but when you go back, they don't have the Moderna available, so they offer you the Pfizer.
You can go. So that would not happen. They would ensure you get the same vaccine you had previously. The efficacy of the vaccine is not proven to be the same if you mix the brands. And there's been no studies on it, so we're not sure if it would cause reactions or anything. So if you get the Pfizer vaccine, we will ensure you get the second dose as Pfizer, and vice versa, Moderna and Moderna.
Okay. I have two here that are, I think, are the same question, but from different locations. If you live in Goochland, your only option is getting the vaccine through the Chickahominy Health District. And as Hanover residents, do we have to wait and get the vaccine in the Chickahominy Health District?
So we highly encourage you to go through your local health district. Working at the call center this morning, I do know that there were multiple people who they said they've called all the health districts in like a 50-mile radius. But that's to ensure that we have vaccines for everyone in our locality. It just makes it easier, and that way our locality is not taking doses from another locality.
Right.
Okay. How do you know what category they have you down for?
So it would be based off of your self-disclosure. So if you had underlying conditions and you went in to fill out the form or register yourself for the wait list, then it would be based off of what you chose. If you call in to register for the wait list, we will ask you, do you have an underlying condition? We'll get the date of birth, so we'll know what age, and we'll be able to assess which category you're in. And as of right now, if you call in to register and you would fall under 1C, we would tell you we'll go ahead and put you on the list for 1C, but we are not yet vaccinating 1C.
Okay. Here's another comment. My mother, who's 97 years old, received her first shot last week. She lives at home, but she has in-home healthcare workers 24/7. Are her healthcare workers eligible due to their occupation?
Oh yeah, most certainly.
I have one here. A patron has said they have used an EpiPen, or they have an EpiPen concern about the Pfizer vaccine, that somebody has had a bad reaction to it. And is one vaccine safer than the other to people who have already known to have an anaphylactic reaction to something?
It would depend on what if you know exactly what the reaction was to. If you've had one to a previous vaccine and you know what the ingredients are, we could look and compare the ingredients. There's a little bit of a difference on what lipids and other, I forgot the word, I'm blanking on it. The modifiers in the vaccine. So some of them use sucrose. I think I could be wrong on this. It is online. One of them, it's either Moderna or Pfizer, has sucrose and the other one does not. But additional ingredients like that, we do have those all listed online. So if you look at the ingredients, you know you're allergic to one of them, make sure that it's known when you register. Again, our health district is only administrating Moderna currently.
Is there a way to find out how far down your name is on the list?
Not to my knowledge.
Okay.
I would have to, I think next week I'm doing more with vaccine clinics, so I don't know if I'll get more information on that, but we can check with some of our coworkers and get back with you guys on that question.
Yeah, I think I've run into some questions like that when I was helping with our hotline. Some people were calling trying to see where they were at on the list to try to get an estimate of when they're going to be contacted for their vaccine appointment to register for that. And we tell people when they call with these questions, we don't even have like necessarily like a ballpark time frame when these people will be contacted, and it's hard to see where they're at on that list. Very few people who work on our COVID strike team who are coordinating these vaccine events have access to that information. And they have a lot going on. So, that would be a large task for them to go check where every individual person is on the list. The main thing is just to have patience. If you registered for that, sign up list, your name's on it, and just be patient. You'll be contacted some days, like in the near future, to get your vaccine appointment date and time set up.
Okay, I have a couple of questions here related to if you registered multiple times, maybe unintentionally or just trying to make sure you were registered at all, do they prioritize those by date? And if so, which date would be the first one they took? And I think related to that, if you happen to be out of town for an extended period of time, when you get your first communication, what does that do to your order in the sequence?
So again, kind of piggybacking off the last question, very few of us have access to those who are the list of people who are registered. My assumption would be that it is, people who registered on January 27th, all in a list, people who registered on the 28th in a list. And I do believe that they separate the lists by phase. So if you are in phase 1A and you just registered today, you will be on phase 1A list, and someone who's in 1B who registered today will be on a 1B list. My assumption would be that it would go by the date. If you're out of town, if they contact you and you're going to be out of town for a month, they're not going to schedule you for a month out. However, they will keep your name on the list and they'll give you another call at a later time.
Okay. I've got a question here about how far in advance would you be notified for your second dose appointment if you don't get it when you get your first shot?
So after you receive your first dose, you have access to that vSafe login, and that's when you can sign up for your second dose. I was able to get mine, and while I was sitting there waiting for the 15 minutes after receiving my first shot, I was able to go on my phone, look at the appointment dates and times for my second dose, and schedule it 28 days out. So they're pretty efficient in making sure that people, are able to get those appointments set up, in that time frame while you're sitting there waiting the 15 or 30 minutes after your vaccine. Sometimes some people have had to wait a whole day to be able to get in there, but people aren't going to be left out of the loop with trying to get their second dose.
I've got someone asking about information on the other vaccines that are in the pipeline. I know of at least 3 that are close. You got any updates on any of those?
Have you done?
I do not have anything off the top of my head, but I would be more than happy to look into that information for you and send it. I could send an email and you can distribute it to the people who were on the call.
Mm-hmm. Okay.
Yeah,
with a brief update on them.
Yeah, we try to make the focus of this just the ones that are currently being available.
Understood. Someone here is concerned about if there any evidence that the vaccine can bring on Guillain-Barre, and if you've had any.
So that is a risk that you run into with all vaccines, unfortunately. But it's a very rare possibility. But again, the CDC and VDH websites do have information on that. I don't remember off the top of my head. I know there have been a few rare reactions arise, but I don't want to say there's been zero evidence of it, or there has been, because I'm not positive on that one. But there is information online, and they do report them, and it is public knowledge. So you are able, you know, if you want to go to the CDC website or VDH, you should be able to find it on either of those websites, and use that when you're formulating if you want to get the vaccine.
Okay. How about, got a question here about seniors with underlying conditions. Will they be given any sort of priority?
So the governor did make a mandate that 50% of our allotted vaccines do have to go to those over 65. And then the other 50% can be distributed among those in the phases that we're currently vaccinating. So if 50% of our allotted doses each week do have to go to those over 65 and with underlying conditions.
And at our vaccine events, we have been holding like senior hours, either before the event starts or after, just to help those who might have, you know, so they can park closer to the building if they need assistance walking to the building or need to be pulled up front and dropped off at the entrance. You know, we're taking those precautions to make sure our seniors are 100% comfortable with the process.
Okay. Originally 1B included people below 65 with serious underlying conditions. Are they still included in that, or is that been moved to another section?
No, they are still included in 1B.
Okay. Let's see. We keep getting new questions. One person has had trouble trying to pull up the VSafe on her app program now. My understanding was that you can you get that before you get a shot, or is it only after?
You could go ahead and download the app, but you won't be able to utilize anything in it until you have received the vaccine.
Okay, and it is a free app when you get it. Is that correct?
Yes, correct.
And it says, where else should they be looking for it if they couldn't find it on their app program?
I think there's a link on the VDH page for it, and it can bring it up for you.
Okay. Okay, once we get confirmation, do we get paperwork to complete prior to arriving for the vaccine, or will we have to wait and fill it out once we arrive?
So when you submit that form to be put on the waiting list, it gathers information, your name, birth date, email, phone number, address, things like that, your health conditions. And then when you get that confirmation email sent to you and it's time to register for your appointment, it will prompt you to fill out a few more things, and then it will give you like a QR code for your phone. You can either print it out or keep it on your phone. So when you go, say your appointment's on Tuesday at 2 o'clock, when you show up and you get out of your car, when you walk up to the front, you say, here's my QR code proving that you've gone through all that process. So, you know, put your information down, see that this is who you are. No paperwork is necessary after that. But for people who don't have access to internet, like a lot of our seniors, they'll be called instead of emailed, and they'll just say, well, this is the time, you'll come Tuesday at 2 o'clock. And when you get here, then you'll have to fill out paperwork. And that's just for people who are internet savvy, don't have any access to internet at all. So yeah, if you do everything online, there's no need to fill out paperwork once you were there.
Are there behaviors that we should avoid so we don't slow down the process?
I would say, you know, like Abigail touched base on, really the one issue that I could think of is like our hotline, they're getting hammered. I mean, 700 calls a day, if not more, of people, you know, asking pretty redundant questions. And I know the community, they're concerned and everything, but you know, if these people have access to the internet, you know, go to these links, you can find out any questions on there that you have any issues with. And as far as like our vaccine events, we haven't run into any serious issues of people slowing down the process. We have it running pretty smoothly. You know, we have a ton of volunteers, thankfully, who are helping with like traffic flow inside and outside of the facility. So the only thing is we're trying to help our hotline not get bombarded with so many calls every day.
Here's someone requesting to go over the March-April timeline and what that actually means. That may have referred to one of your slides.
So we don't have, we don't necessarily have a specific timeline on dates, but we are estimating based off the amount of people who are in phases 1A and 1B and the amount of vaccines we have currently. We are estimating that that is about how long it'll take to vaccinate those in 1A and 1B. And as of right now, we have been told that the amount of vaccines we get per week for the whole state, 105,000, that is expected to remain that number until March at least. We have not been guaranteed that in March that will increase. That is just, we know that that's the number we're going to get per week until then. At that point, we don't know.
Well, this one is looking ahead.
But they just can't increase production.
Okay. When the vaccines are approved for children, are there any plans to offer clinics for the children, or will there be some similar registration, or will there be clinics held at the schools, or are there any plans looking forward to taking care of our children when the vaccines are available?
I don't think we have any plans in place for clinics for kids yet, because we are still waiting for that authorization to come through, because they do have to have trials with children. So we do have to wait for that FDA approval or emergency use authorization to come through before we can even plan that. You know, all our energy is kind of focusing on what we have available to us right now and are able to vaccinate. So as of right now, we don't have a plan in place, but I'm sure as soon as we get that EUA, we will be right on it and ready to get rolling with those vaccines for our children.
And here's somebody who wants to know if you still need volunteers, non-medical volunteers, to help at events, and if so, how to sign up.
Is there a link online?
I believe there's a link online for volunteers. We've had a great turnouts so far, and we're so thankful for that. I'll make a note of that, and if there's a way that I could find that link or more information on that to relay back to you, or I can, you know, put my email out at the end of this and I can send that information out. But I know for a fact there is a link somewhere out there.
And we are more than happy to have more people sign up to volunteer.
Oh yes.
I don't think we can get enough right now.
Yeah, it's been a great help.
I think this may be our last question. And I think you addressed the first part of it earlier. And as someone says they've just had a shingles vaccination, how long should they wait before getting a COVID vaccination? And I think you addressed that in the program. But then there's something else.
Right now they recommend. So right now they recommend 14 days between any vaccination. I would have them double check with their physician to ensure that they don't want it to be a longer time frame. I know before I worked with the health department, I worked in an interventional pain clinic, and at that clinic with the steroid injections, they did want to wait 3 weeks before, you know, so if they got the COVID vaccine, we would not give them an injection for 3 weeks. So just make sure they check with their provider. CDC guideline is 14 days on either end. But double check with physician and then.
And there's another one that's a question that I'm asking because I've heard it in the news. A question about taking your typical NSAIDs or analgesics near the time of your vaccine, that it could reduce the efficacy. What's What's the information on that?
Right. So if you take, Tylenol, aspirin, things that, help if you have a fever or something like that when you are sick, it suppresses your response. So I'm not sure the exact studies behind it, but they do advise you don't take them, the day before, the day of, and like probably the day after, unless you are having some of those side effects, to give your immune system the best response to the vaccine, because we don't want to suppress that. Because we want it to, we want your immune system to go full force so that it recognizes this protein and creates this antibody. So if COVID does enter, it'll just bring on the attack.
Okay, I think that covers our questions for today. So thank you again so much for being with us, Caitlin and Abigail, and for all of you who have joined us. I hope you got a lot out of this program. And again, it will be available on our webpage in a day or two. And please keep a copy of these links. I'll make a copy available at the Ashland Library, and it will be as part of the video as well. So thank you all for coming, and look forward to more great programs from Pamunkey Regional Library. Bye-bye.